How does trauma affect brain structure in schizophrenia? Have you ever wondered how trauma can shape the brain, especially in relation to schizophrenia? The connection between trauma and brain structure is fascinating and important for understanding long-term outcomes in schizophrenia. Trauma, particularly during childhood, can lead to significant changes in brain areas that play a role in emotions and thinking. When we look at the brain, several regions are particularly affected by trauma. The amygdala and hippocampus are two key areas involved in managing emotions and forming memories. Research shows that trauma can reduce the size of these regions. This reduction can make it harder for individuals to recognize emotions and navigate social situations, which is often a challenge for those with schizophrenia. Another important area is the anterior cingulate cortex, which helps with emotional and cognitive control. Trauma can lead to a decrease in volume in this region, potentially causing difficulties in processing emotions. The orbitofrontal cortex is also impacted, as it is crucial for decision-making. Changes in this area, such as reduced volume, may contribute to cognitive challenges seen in people experiencing their first episode of schizophrenia. The insula, which is involved in processing emotions and regulating mood, often shows smaller volumes in individuals who have faced childhood trauma. This reduction might explain why some people are more vulnerable to experiencing psychotic symptoms and emotional issues related to schizophrenia. Interestingly, the striatum, which helps detect threats and process rewards, can become enlarged in those exposed to trauma. This change could be an adaptation to early life stress but is also linked to brain alterations associated with schizophrenia. These structural changes in the brain are thought to connect early trauma with the symptoms of schizophrenia. For instance, the smaller volumes in the hippocampus and amygdala are linked to difficulties in recognizing emotions, a common issue in schizophrenia. Similarly, changes in the orbitofrontal cortex are associated with cognitive impairments that many individuals face. Moreover, trauma can interact with genetic factors to heighten the risk of developing schizophrenia. Traumatic brain injury during childhood can disrupt brain development and increase the chances of experiencing psychotic symptoms. However, the exact pathways are complex and not fully understood. Understanding how trauma impacts brain structure in schizophrenia highlights the need for early detection and intervention. Therapeutic approaches that consider a person's trauma history can lead to better cognitive and emotional outcomes. Tailored treatments focusing on social cognition and cognitive rehabilitation can help address the brain changes caused by trauma. In summary, trauma affects brain structure in schizophrenia by altering volumes and shapes in areas related to emotions and cognition. These changes contribute to the symptoms and cognitive challenges associated with the disorder, making trauma-informed care essential in managing schizophrenia effectively.